Hi, I am Dr. Hiranappa B. Udnur, practicing at Sakar Nagar at Inspire Specialty Clinic. Asthma, it is usually a self-diagnosis or physician diagnosis. We don't need much of the tools to diagnose asthma. Diagnosis of asthma is easy actually, but we need certain confirmatory stages, more of objective tools to make a confirmation of an asthma. If somebody is having a long-standing history of all these symptoms like wheeze, cough, chest tightness, which keeps on coming on and off, and there's the early morning wheeze, and there is a definite allergy history or atopic history and the family history, then it's easy to diagnose an asthma. We don't need any other device to diagnose asthma. With auscultation, all those things confirmed. It's mainly dependent on the history, long duration of history that clinches the diagnosis of asthma. With auscultatory or physical findings with bilateral expiratory wheeze, then we document that he is an asthmatic. Sometimes certain diseases, all that wheezes is not asthma. So certain other viral infection can cause wheeze. So you should be careful to make a diagnosis of an asthma. We need a long duration of symptoms. Along with that, sometimes we have a difficulty in diagnosis of asthma. We take a help of peak flow meters, where we monitor morning and evening maximum expiratory flow in the first second. This will be monitored by the small device. So with those device, we monitor over a 2-week chart, and morning and evening, if at all any kind of symptom variability is there, then we can diagnose an asthma. Other tool is a spirometry or a lung function test. When you do the lung function test, normally when you take a deep breath, in 3 or 5 seconds, we should be able to force all the air what we have taken after a deep breathing. So in a forced expiratory breathing maneuver in a spirometry, in the first second, if somebody is not able to blow out 70% or 80% of their air which is being taken, then we say that it is obstruction, and we can repeat it by using the bronchodilator or a nebulization salbutamol and check for the reversibility testing, where if there is a 200 ml improvement or a 12% improvement, then we confirm the diagnosis of asthma. That's how we diagnose asthma. Regarding an asthmatic attack, how do you identify an asthmatic attack? So somebody who is having a stable asthma, or sometimes who is not a known asthmatic also, he comes with a worsening symptoms of wheeze, chest tightness, breathing difficulty, and with auscultatory finding of this thing, which is more than the stable state on a routine activity, sudden worsening of the clinical status is there, then we can identify an asthmatic attack. Usually there should be some kind of triggers, like if there is a dust exposure or an infection or an emotional trigger. There are many identifiable triggers, or if there is a construction work is going nearby, these triggers will help us to identify what is the cause for an asthmatic attack, and you treat it accordingly.